Good morning, everyone. My name
Mo-
is Kay Rowe, third-year medical student at Trinity Medical School in Warner Robins, Georgia. First of all, I would like to thank the Southern Medical Association for this opportunity. Thank you for being interested in my medical device topic, which is a little different area of the medicine. I have a background as an R&D engineer for various medical devices, so I'm excited to present the innovation of the stethoscopes that are impacting daily clinical settings worldwide. This poster focuses on the sensor technologies used in electronic stethoscopes in the market. Electronic stethoscopes have gained a lot of attention for telemedicine after the COVID pandemic. Wearable devices and consumer products like Apple and Samsung watches became popular to detect biodata. However, those are not approved as medical device from FDA. And these are very new technology and device that do not have regulations and standards yet. Therefore, there are ongoing research to maximize the potential of electronic stethoscopes, especially in early cardiovascular disease detection and prevention. Cardiovascular disease remains the leading cause of the mortality worldwide, and acoustic stethoscopes often fall short in prevention by detecting early pathological heart sounds, especially low-frequency components like S3 and S4 murmurs. Our research aims to explore how modern sensors can improve diagnostic accuracy and accessibility. Acoustic stethoscopes have limitations of detecting various murmurs because most murmurs have a low volume, low frequency, and highly influenced by environmental factors like noise. Therefore, electronic stethoscopes help overcoming limitations of acoustic stethoscopes and enhances early detection of the cardiovascular diseases. Our study compared the three types of the sensors that are currently used in electronic stethoscopes in the market and evaluate performances like quality, power usage, and frequency response. Please take a look at findings in Table 1 and Table 2. Caroline, would you scroll down a little bit? Thank you. MEMS sensor emerges as a top choice because of the highest frequency range, have the highest noise resistance, power efficiency, and small in size. Price range is low to moderate. MEMS sensor in graph figure number 2, there's a C, that's a MEMS sensor. So graph C, you can take a look at the signal performance. Piezo sensor performs well in durability, high accuracy, and noise resistance, but they are bulkier and require additional circuits. So integration price is also high. These are robust and resist to noise, but requires amplification, so even more expensive. So that piezo sensor is B in graph figure. Condenser mics offer decent performance but are less sensitive to low or high frequencies, which are the range of the most heart murmurs, but cost-effective with a balanced performance. So the condenser mic is D. Table 3 shows the application suitability. MEMS sensors are ideal for wearables, telemedicine, and pediatric use. Piezoelectric sensors are good for robust diagnostic environment, and condenser mics work well with the cost-sensitive settings. The choice of sensor directly impacts the clinical effectiveness of electronic stethoscopes. MEMS technology offers the best combination of sensitivity, size, integration, and holds a promise for AI integration in the future as well. Pairing these sensors with the various signal processing algorithms could revolutionize the prevention and early diagnosis of the cardiovascular disease with cost effectiveness, less invasiveness, earlier, faster, and more accurate methods. In summary, sensor choice matters. Innovation technology in medicine can bridge the gap in early detection and prevention of cardiovascular disease accurately, easily, and economically. Thank you very much for listening. I would love to take your questions and answer any of your thoughts.
Well, very nice presentation. I have one question to start this out. My question is, medicine, there is treating the patient and also having humans who are having the interaction. So my question to you is, I think in bringing in new technology such as these sensors are important, but how would you suggest using this that it can augment the practitioner but not dull the practitioner's skill? Meaning that I think in order for this thing to work, it ought to train the practitioner. So then when things fail, the practitioner is actually able to use a thing that went back to the 1700s. Because what's going to happen if suddenly no one knows anything and it's all on chips? It's no different than cars. There's certain mechanical things that need to be done. And it looks like you're a very good person for this. How would you propose keeping the human and keeping the human's ability to learn in the loop?
Absolutely, that is a great question, and everybody is asking this topic as well because right now electronic stethoscope is not perfect, and even if it's being perfect, the physicians have to have both acoustic and electronic stethoscope in hand. So they the guidelines suggest that the use the acoustic stethoscope, and there's some certain doubt, then use electronic stethoscope because electronic stethoscopes, there's a pros and cons. It depends on what brand you use, what sensors you use. So certain brands detect the low frequency very well. Certain brands detect the high frequency very well. So right now there is a discrepancy. But even if there's a perfect electronic stethoscope, I think we can think about ECG and EKG. We use that technology, but also doctors analyze and making sure that what's going on. Like, is there anything that we have to dig deeper, or can we trust the ECG? That's totally physician's experience comes in. So I think it's a still area to explore and dig more deeper into it. But right now, even student we are recommending right now to use both acoustic and electronic at the same time because there is no guideline or regulation as well. So there's no definite absolute this is our solution. I don't think we can say that this electronic stethoscope is a definite solution. We cannot say that. This is a great tool for the patient who cannot go to the clinic or certain emergency settings and rural area, they cannot really have easily accessible clinics and
Sure.
hospitals. Yes.
Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.